Welcome to this educational video on reflective practice. Reflective practice is the mode that allows us to link thoughts and action to reflection. It allows us to critically analyse the actions with the view to improving our professional practice. Reflective practice is already in use across many health and social care professions in Ireland today, and the aim of this video is to introduce reflective practice into clinical physiology. Reflective practice has been hugely beneficial for me. It has taught me how to critically analyse and learn from events and situations, personally as well as professionally. My main goal of this video is that I hope that it will motivate you to start using reflective practice and appreciate some of the benefits for yourself. I hope you find it beneficial. Thank you for watching.
Reflective practice, I would say, is a habit, a regular habit of reflecting in some way or other. It might be writing, it might be talking with a critical friend, or even having meetings. It might be quite a short piece of writing about one area, one event that's happened, or one aspect of that event, or one part of the writer's history in relation to that event.
I was first introduced to reflective practice 18 months ago when I embarked on a Master's in Education and Training Management at DCU. We were required to write weekly reflective journals to demonstrate our learning. Not having prior experience, this was difficult for me, and to make matters worse, the journals were part of our ongoing assessment, so I had to learn fast. Engaging in reflective practice has been life-changing for me. My journey from novice and skeptic to strong supporter and advocate of reflective practice has led me to produce this video.
The introduction of journals at higher level education for master's students has been a very beneficial experience for the students. Now initially they start off and they're quite anxious about writing in journals because they don't really know whether what they're writing is descriptive or reflective. Then over time they can look back over their journals and see their own development and see how they have grown personally and professionally.
It is only through reflection and analysis we strive to understand the experience. Should that be our dealings with a difficult patient or assessing our knowledge post a CPD event. By the end of this video, I hope you will have an understanding of what reflective practice is, how it is used in other professions, and how it may be used within clinical physiology to demonstrate professional development. Clinical physiologists work as part of large multidisciplinary teams. They are responsible for the diagnosis and monitoring of heart, lung, vascular, neurophysiological and gastrointestinal disease.
Generally, after physiotherapists attend a conference or a course, we encourage them to write down their reflective practice so that they can see in words what knowledge, skills and attitudes they've gained from attending the conference and course, which often makes it a little bit clearer about what that means for their practice. They also use reflective practice to reflect on particular incidences, maybe with patients or dealing with family, that they feel didn't go as well as they could have, and they use reflection to learn from that and to improve how they would deal with that situation next time round.
Descriptive writing is more like just telling a story. It's the account. It's an event, for example, where you start talking about the event and you go through the event, the issues in the event, and then come out the other end. If you are talking about an event, it might be that you go into description of colour or a nice blue sky or a sunny day, things that actually are not really relevant to the reflection as such. In deep reflection, there is a reflection on the process of reflection. Have I covered everything? Are there issues that I haven't actually related to this? In deep reflection also, one should take account of prior experience. So, for example, if I have a particular sort of experience that relates to the current event on which I'm reflecting, I must recognise that that is the perspective from which I come. It is the prior experience in my head that will direct the way in which I deal with this current issue. And that might be inappropriate. It may be taking me away from issues that I should reflect on, but I can't see at the moment because that's not in my head. Another aspect of deep reflection is the taking into account of other people's perspectives on the same event. So it's recognising that if I'm reflecting on something, I can only reflect from the way I see something. In addition, my emotional state will be part of my reflection in deep reflection. So there are a lot of differences between superficial or descriptive writing and deep reflection. And it is from deep reflection that we can learn.
Since using reflective practice, my approach to CPD events and conferences has changed. I now look at what I can gain from the event and how it will fit in with my professional development needs and ultimately improve my practice. I find I learn more from events because instead of just taking notes, I now turn my notes into a reflective piece that links the learning with my professional role. The advice I would give somebody starting out on reflective practice is don't be fearful. Be honest with yourself, be that negative traits and positive traits. You can show somebody how to write, but the best way to learn how to write reflective practice is to try it and to keep at it until you get it right. I found it very challenging at the beginning, but now I wouldn't be without it both personally and professionally.
It's important to know that reflective practice and journal writing does take time. But I suppose, like any transformative process, it does take that time, but it's a positive journey.